So today we are going to look at clinical management of HIV for an adult. And next week, we are going to look at clinical management for exposed infants and for viral hepatitis, syphilis. And then we're going to also look at clinical management for pediatric and adolescent clients for HIV, TB, and other STIs. So we have a case scenario. We have two scenarios. I am going to discuss the first scenario, and I will let you walk through the second scenario. Case 1. Susan is a 43-year-old Hispanic female who presents with fever of 103 Fahrenheit, non-productive cough and dyspnea, which has progressed for 5 days. She was diagnosed with HIV on 2nd of January 2015 and was registered into care. She was placed on ARTS AZT 200 milligram orally for 3 times daily. After her first clinical management visit, she was lost to follow-up and never again showed up at the clinic until today. She uses injection drugs, no tobacco or alcohol use, no known allergies to drugs. She was born in Mexico and she lives in country X. Her highest level of education is secondary. She is a sex worker. She has greater than 10 sexual partners. The types of sexual activity, she has a vaginal, anal, and oral. She rarely uses condoms, and she always has sex without disclosing HIV status. On physical examination, she was pale, diaphoretic, acute respiratory distress. She has a temperature of 103 Fahrenheit, pulse of 96, respiratory rate of 30. Her blood pressure is 110/70. Her weight is 99 pounds. She has oral thrush. She has babacilla crackles. She has tachycardia, but no murmur, and her abdomen is not tender. Her lab evaluation result shows that her HB is 7, her white blood cells is 43,000 cells per cubic meter, lymph 41, monos 9, SO6, basil 1, platelet 250, CD4 11%, viral load 280,000 copies per mil. Her DFA was positive for PCP. So her treatment was that she was hospitalized on day 1 and she was given IV Bactrim and 40 milligram prednisone twice daily. On day 2, she improved. On day 3, she improved with a respiratory rate of 18 and oxygen saturation of 98%. But on day 4, she relapsed with a fever of 102, elevated AST, ALT, alkaline phosphatase, mobiliform rash, and we are going to discuss and decide the treatment outcome for Susan. When you have a case, so this case tells us the story from the beginning to several days of clinical management to guide us in data entry. Let's go to reality. When you start using the system in the country, there are chances that the record of a client might not be on the system, especially those that were lost to follow-up or for some reason was registered into care a long time ago and that record is not yet on the system. If those type of clients comes in with a paper referral and they have no record for clinical management on the system, you will need to create the client's account just like we did in general population screenings. Enter the past record of the client screening and then refer the client for registration, register the client, and enter at least the first clinical management encounter and move on to the current state. If the client has a record on the system, the first thing to do, you log in to patient management and reporting system. On the left side of the page is the pages menu. When you expand this menu, you have 2 functionalities that you will need to get appointments for the client, record the client's vital signs, and then start the clinical management encounter. Those functionalities are appointments and patient monitoring and clinical management. When the client walks in and the client has an appointment on the system, you come to appointments/patient monitoring and go to view pending appointments. This time, you are going to see a list of all the clients who have appointments and the dates of their appointments. And you're also going to see the purpose of the appointment. If the purpose of the appointment is HIV clinical care, you can now take the unique ID of the client, and then you come back to appointment/patient monitoring and go straight to create visit/record vital signs. Only after you do this will the case management file be released in the doctor's office. Let's give this client the temperature, the blood pressure. Okay, the scenario says the temperature is 103, so we're going to use that, 103 Fahrenheit. The blood pressure was 110/70. The pulse, so let's look at the pulse. So the pulse is 96, respiratory rate 30. The weight was not given, but we'll assume that this client is, okay, the weight was given to be 90 pounds, right? 99 pounds. So we're going to put 99 pounds. And then the height was not given. We'll assume that this client is 165 cm and the BMI is calculated automatically. And then when you click on send, the file for this client will now be released in the doctor's office. Now the doctor is going to come to pages, come to clinical management, select waiting clients, and you see the list of all the clients who has an appointment for today who are ready to be seen, which means that the triage or the nurse, anybody who is taking vital signs or registering them when they come in has done their job and they're ready for clinical management. So now it is time for you to take the unique ID of a client that is ready for clinical management and then come back to clinical management, come to HIV care card. The purpose of visit is HIV clinical care, and so you will come to HIV care card. If the purpose of visit is TB clinical care, you come to TB care card. And if the purpose of visit is other clinical care, you come to other care card. Because it is HIV clinical care, I will come here, put in the unique ID and get forms. On the form, you will see flags of when a CD4 was done and viral load was done. You also see the trends in CD4s and viral load. You will see the results of drug resistance testing, if any, and then you will also see the basic demographic information, unique ID, the biological sex, and the current age. The vital sign that was taken, the most recent vital sign will appear here. If in your office you want to repeat the vital signs, then you can record new values. But the right side of the form gives you a trend of all the vital signs that has been recorded for this client. If not, you move to symptom review. Because this client is an adult, the symptom review form for adults is different from the symptom review form for pediatric and exposed infants. So today is 17th of February, 2022. So according to the scenario, she complained about shortness of breath. She also complained about sweating excessively. She complains about persistent fever. And weakness. If you have any additional comments, you can write it here. If not, now it's time to put your own detailed finding or your findings on physical examination. The scenario says on physical examination, she was pale, diaphoretic with acute respiratory distress. I can choose to copy this and just paste it here, or you can type it. And then the scenario also says that she has temperature of this, blood pressure of this, pulse and respiratory rates. I will copy that. The scenario says that her weight is 99 pounds. You can choose to copy this or just type it in. So I'm going to copy this also to make it faster. I'm also going to copy all of this. So you write the notes just the way you do your physical exams and how you record it in reality. You're going to type it in here. So once done with this, the next thing is to select if you think that there's a new opportunistic infection or other problems. Here she has oral thrush. You suspect that she might have pneumonia, but not TB. She has fever. She has shortness of breath and cough. She has significant unintended weight loss. The family planning type, she says, she rarely uses condom. And so she says she's on oral contraceptive pills. This is not applicable because the patient is now available in the clinic. She's symptomatic and she might have an opportunistic infection. So your plan is lab evaluation. Maybe you want to screen for TB, or you want to do an OI prophylaxis. You want to send her for adherence counseling since she did not come back to the clinic since 2015. Hospitalized, symptomatic treatment or pain control. So you select what it is that you would do for that type of client. The ARV therapy is you want to restart treatment. So she started treatment in 2015 and she was lost to follow up and she did not return. And what she was taking then was, you said AZT, right? You might want to decide what treatment you want to start for the client. So you select from the list here, whatever treatments. This list is only populated with TB and HIV treatments. Anything outside of TB and HIV, you can type it here. So it says she has IV Bactrim. And we want to be 20 milligrams / 100 milligrams per kg per day. And you are giving this to start. The scenario says that and prednisone 40 milligrams twice daily.
Hi, Mildred.
Yes?
One question, please.
Okay.
I'm just wondering, okay, if it is possible, as it relates to the plan.
Okay.
To me, and the sign and symptoms that she presents with, she's looking sick. And more than likely, she will require hospitalization.
Yeah.
So do we really need to do like the lab evaluation, adherence counseling, and the other stuff at this point? Because when she go to the hospital, they're gonna do the labs, so because it will take some time for the labs to come back to us and other things. So I'm just wondering if this could not be done when she go to the hospital, and then we will follow through with the others when she visits us the next time.
Yes, it is very flexible. So you can choose. So depending on how you do things in your country, you can choose to fill this in or leave it blank. But in the events where only the clinical care coordinator treats the patient, you might want to leave a note here in case if the hospital will review to see what they are to give or what the client is on or what they're supposed to do. But you can leave plan, ARV therapy, regimen, and all of this blank, and the hospital will do what they do in the case notes or if it's on the system.
Okay.
All right. So I will save this. And once it is saved, because this is an encounter form, it is cleared for new entry for the next visit. So after I go through these forms, I will show you how to review case notes for past entries. The next thing is its TB symptom checklist. I'll record the date. She has been coughing. Has she been coughing for more than 3 weeks? The scenario says for the past 5 days. Is she coughing up blood? She says no. Excessive night sweat. She says she sweats all the time, day and night. So I'll just fill in no for the rest. Fatigue, yes. Appetite. Sorry. So after selecting this, if you have yes to one or more question, you want to fill in the last line here. So is this a suspect for TB? Let's assume we want to suspect and refer for AFB or any TB screenings and X-ray, and we want to start TB treatment. If she's not on any prophylaxis, we want to maybe say IPT, TPT. So once this is saved again, the form is cleared because this is an encounter form. So on the system, the encounter forms are forms that you reuse at every clinic visit. The forms that are not encounter forms are forms that retain their values for you to update when necessary. Yes? Someone raise hand.
Yes, Mildred, it's me. For the confirmation of TB, gene expert needs to be included, not only AFB.
Yes.
So maybe a box needs to be there for gene expert.
Okay, so I might change this. There is a part for that here, but I might just change this to refer for TB screening, and then the drop-down list to have all the screenings and you select.
Perfect.
Okay. Then the CD4 or viral load. If you have a new value for CD4 and viral load at this visit, you want to fill it in. The scenario gave us of the lab result that says that the CD4 was 11%, viral load 280,000 copies per mil. So I'll come here. Today is 17th month of February 2022. So I want to assume that things were done so fast, everything is working well. The CD4 request was done, it returned as soon as the request was sent. The result was ready within hours, and we have the value here to be 234. Was it 234, 235? 235 cubic meter. And we have the viral load value to be 280,000 copies. And then we save this. Now, as soon as this is saved now, the flag should be updated to give you the next CD4 date to be 3 months from now and viral load 6 months. It is not a hard rule on the system, so you follow whatever timing you have in your country, or make your clinical decision on when you want to order a CD4 or viral load. But the system put these flags to just remind you that this client does not need a test until the next 3 months at the earliest. And once that time elapses, it becomes red and tells you that the client is due for CD4 on 17th of May 2022, and you decide whether you want to ignore the flag or order another test for the client. Then we have clinical staging. This client is losing a lot of weight, severe weight loss. So stage 3, has had persistent fever. But, she also has unexplained anemia. Her HB is less than 8, so 7. So this puts her in stage 3. And then we're going to save this. So you have to enter the date. And save. Once the staging is done, if she's on ART and she's experiencing drug reaction, you want to fill in what type of adverse drug reaction she has. And if she doesn't have any on the list, you can type in anything here. But if not, you skip to the mental health assessment or evaluation. Now, this is a very bulky form, but I know they say it is required to for every client on ART every 3 months or on every clinical visit. It tests for 15 domain of mental disorders. It tests for depression, for anger, for mania, anxiety, trauma, for suicidal ideation, for psychosis, sleep problems, memory, repetitive thoughts and behaviors, for stigma, for personality functioning, for substance use, sexual behavior, and dissociation. The first part of the form will ask you for the date and some basic information about behaviors in the past 3 months. So has the client been incarcerated in the past 90 days? I say no. You want to fill in the current medications, both HIV and psychotropic medications that the client is on and the adherence to those medications. So for now, at this visit, the client is not on any medication. Let's look at the risk behaviors of the client in the last 90 days. She said she has had unprotected sex in the past 90 days. She uses drugs and she has had sex without disclosing HIV status. The next is the major category of mental disorder. You are going to select this, but before this, there are assessment questions that measures the extent to which you can refer the client or classify the client if there is any sign of the disorder or anything that needs to be flagged. So the first domain for assessment is depression. So you want to ask the client, in the past 2 weeks, has the client had little pleasure in doing things? And has the client felt down, depressed, or hopeless? So let's say she says she has never felt that way in the past 2 weeks. When you finish with a domain, there is a box here that asks you to record the highest domain score. The highest domain score is going to give you the indication of whether to probe for further analysis or for further criteria to diagnose the person with a particular domain, or for referral of the client to a psychiatrist or a psychologist. For all domain, once the domain score, the highest domain score is mild, that's 2 or greater, you want to refer or investigate further. But for substance use, for psychosis, and for suicidal ideation, once the domain score is greater than 0, you want to take action immediately. So the highest domain score for depression is 0. You want to ask the client about anger. So have you felt more irritated, grouchy, or angry than usual in the last 2 weeks? And she says no. The test for mania. Has she slept less than usual but still have a lot of energy? Has she started lots more projects than usual or doing riskier things than usual? She said she sleeps all the time, she's always tired, and she has not started any projects. The highest score is 0. You want to test for anxiety. Has she felt nervous, anxious, frightened, worried, or on edge? Let's say she says 2, several days in the 2 weeks. And has she felt panic or was unusually frightened, avoided situations that made her anxious? She said for both, a lot of times she feels that way. So the highest domain score here is 2. But assuming she answered, let's say, all the time, every day she feels way, then the highest domain score here is 4. You are recording the highest score. For all 3 questions, which question has the highest score? The highest score is what you are recording, and you are going to refer based on the highest score. So trauma is, has she directly experienced or witnessed a traumatic event? Has she attempted to avoid distressing memories, thoughts, or feelings about or closely associated with the traumatic event? So let's say she says no to both. Has she had thoughts of hurting herself? She says no, she loves her life. Has she heard things other people couldn't hear, such as voices, even when no one was around? And has she felt that someone could hear her thoughts, or that she could hear what another person was thinking? She says no. For sleep problems, has she had problem with sleep that affected the overall sleep quality? She says no. Has she had problems with memory, learning new information, or with location or finding way home? She said recently she started feeling that way. In the past 2 weeks, she has had that happen for several days. So we'll say 2. Has she had unpleasant thoughts, urges, or images that repeatedly enter her mind? Has she felt driven to perform certain behaviors or mental acts over and over? She says no. And stigma. So we're asking her, has she felt that people treated her differently because of her HIV status? And has she felt out of place in the society, or that she doesn't belong? And she says nobody knows about her HIV status, and so she doesn't feel that way. So personality functioning, has she not known who she was, or not felt close to other people, or enjoyed relationship with them? She says no. And has she drank at least 4 drinks of any kind of alcohol in a single day? She says she doesn't take alcohol. Has she used any medicines on her own that is without a doctor's prescription, or greater amounts or longer than prescribed, or illicit drugs? She says yes, she always do drugs. Has she tried to reduce or stop drug or alcohol use? She says no. And has she engaged in sexual activity to numb painful feelings and or memories or reduce anxiety? She says all the time. Has she felt guilt or shame either before or after engaging in sexual activity? She says all the time. And has she felt detached or distant from herself, body or physical surroundings, or from her own memories? She says most of the time. Now you've asked all questions, tested for the 15 domains. You know which domain you are going to refer for. You're referring for dissociation, for sexual behaviors, for substance use, for memory, for anxiety. And then we save. So once this is saved, we move straight to treatment. Now, on the treatment form, there are 3 types of information. The top, that gives client's most recent prescription history, only lists medications that has been dispensed to the client from the pharmacy. The screening gives you screenings, all the screenings that has been recorded on the system for the clients and the screening results. And then you have a form where you select the ARV that the client is going to be on and the duration of time and whatever notes you want to leave. And then the right side of the same form gives you the history of that treatment. So let's say you want to put her on this first line. And the dose is 300, 200, 600. And you want to try for 30 days. And you want to say something like, screen for you can add more drugs on the list for both TB and HIV. So let's assume we want to put on prophylaxis, and this is first line also. The dose is, let's say 2 tablets once daily. So you put what the correct dosing that you use in the country is, and you want to give this for, let's say 18 weeks for now, and then save. Now, once this is saved, you are going to find on the right side of the form the history of medication. So if another doctor sees this client, they can know what medications or prescription to keep refilling and what notes you have left there. If the client goes to pick up these drugs, you'll find the date of pickup from the pharmacy up here. So if this client comes back on a different clinic day, and you still find this prescription history, but nothing here. So it's either one of two things happened. Either the pharmacy did not record or the client did not pick up the drugs. So you want to find out if the client is really taking the medications, if they ever went to the pharmacy to get the medication, because you can't find any pickup history here on the form. And this concludes all you do on clinic days for HIV clients. So what you do is vital signs, symptom review, TB symptom check. You use this optionally to update CD4 and viral load values if you have new results. You do clinical staging if anything changes. You want to stage, at least you need to stage at least twice a year. Then you have adverse drug reaction, which is also optional if the client complains of side effects. Mental health assessment based on how often you do mental health assessment for clients. And then treatment to fill in new medications or refills that you order and check if the client collects these medications. Any question before I go further?
No, please, from me.
Yeah. Now we looked at these clients, but let's assume this client is coming back on a different day and a totally different doctor is going to see this client. And you have this ID on your waiting list and you have no idea what has been done on the client or the client history, but you want to review before the client comes. When you come to pages, you come to clinical management, and then you come to previous encounter. Enter the unique ID for that client and click on previous encounter. So this gives you all of the case notes of the clients for all those encounter forms that was cleared after you entered. And so you can see, okay, this is what was done at this time on this particular date. So for as many encounters that is filled up, you'll find a container like this, several of them on the page with the timestamp that it was filled with the most recent first. Then you'll find history of CD4s and viral loads that were recorded for these clients. You'll find the clinical staging that was recorded for the clients and the mental health assessment, and you get the history of everything ever recorded. So this is like the care card history for a client. The other part we just looked at only gives you forms for the current day so that you don't have a screen that is overcrowded. So anytime you want to review past history, you come to previous encounter and enter the unique ID. There are other types of clinical management that is not HIV. And we use those ones for clients who do not have HIV but have TB, clients who do not have HIV or TB but have other STIs. Yes, Dr. Peters, there is a graphical representation, but it's on the surveillance part. If you want me to put the graphical representation of trends in CD4s and BMIs, I can do that. Okay, so I can actually add a graphical representation of CD4 and viral load. And so where will you prefer it? You want it here or you want it on the care card? Here. So do you want it here? So after the values, I can put just a graph on top of it.
Yes, that would be good. Mm-hmm.
Okay, so let me write that down. I'll do that today. So any more questions or recommendations?
Thanks, none from me.
Okay. So there is another functionality that I have not showed you. If you're on the client care card, you want to order a test, or you just want to update a screening result that is not CD4 or viral load, or you want to look at previous screenings that is not HIV or TB or syphilis. You don't want to go to the treatment. Or this client is here and you're on the care card and the client dies. or the client is here and the category of the client is adult, and you see that this client is 9 years old and you want the forms generated to be pediatric, you come back to pages, but this time you are going to come to screenings, category / mortality update. So almost everybody is going to have the updates permission when the admin creates the account. When you come to this and expand, you have 3 functionalities: to order or update screenings, to update client category, so if you want to change from pediatric to adult, and to register death if a client dies. When I come here to order screenings, I can put in the unique ID, get file. So this gives you the file of the clients, but gives you only the screening files without personal information. So if you have a staff who you do not want to have access to a client's record, but should update screenings or lab results, they will come here, enter the unique ID. They'll have access to the forms to record results without having access to the clients or knowing anything about the clients, but just update the results and go to the next client. So in the event where you want to do a different type of TB screenings, this is where you come and select a different type of screening. So it's either you use the symptom checklist form, I will update that, or you just come to the updates, order the screening here, and the results will be recorded here. The same thing with syphilis screening. And if you want any other screening, the type of tests will have a drop-down menu populated with the list of screenings that you create when you configure the system. So you have all possible types of screenings, or an exhaustive list if you get the list of screenings from the lab to know the kind of screenings that are available in the country and the type of screenings that they usually send as overseas tests, so that you have a list, and when you want to send for a screening, you can put in the unique ID. So you put in the date, you select the type of screening, and for now we are awaiting results, and I'll put in the date. Once you do anything here on this page, what happens here is, if you come back to the same client's care card and you come to treatment, you will always see all of the screenings and their results. So when you are doing treatment, you are informed with all the results of the different screenings that the client has done, regardless of the type, whether HIV or TB. So you have a history of all screenings. Whenever a drug is prescribed for the client, regardless of whether you are the one who prescribed or not, you see the history of the drugs that the client is currently taking and the history of medication pickup, regardless of where the medication was prescribed or what it is for, so that when you prescribe, you'll take note of your drug-drug interaction and all that stuff. So we'll go back to that. So let's assume that for the same client, there is a drug resistance test that the result just returned. We'll come to drug resistance testing. Fill in the date. So the form automatically has the most recent CD4 count and the most recent viral load recorded. So does the patient meet criteria for virologic failure? So if we want to assume that this is yes or no, you want to fill this in. So let's say yes or no for now. Is a change of heart under consideration? Let's say no. We are sending for HIV drug resistance testing, or we are recording drug resistance tests. And we want to assume that we did a resistance for nevirapine, and it has a K103 N mutation, and it's a high level resistance. And we also did for efavirenz, and it has a K106 or 103S mutation, and it has an intermediate resistance, and you save this. Once you record everything you need to do here in the upload, you can come back to the same place, and you want to change client category. This client is currently registered as an adult. If this client was wrongly registered as an adult and you want to change the category to adolescent exposed pediatric pregnant, you do that here. And so it automatically updates the new encounter forms that you are going to have for the clients going forward. If you also want to, let's assume that this client is hospitalized and the client dies. You come to register death, put in the unique ID, and then you want to select, change the status from alive to dead, and then you select if the death is HIV death or HIV-related death. And then you update. So this now updates and records the mortality for the client.
Mildred,
Yes?
what about date of death?
No, the date of death. Okay, you want me to put the
Mhm.
date? Because the system just timestamps the date. So let me put date of death in case if it's later.
Okay. Yeah. Okay.
Okay. The system timestamps that, but now I'm thinking you might just be updating on a different day that is not the day of death.
Right. Mhm.
Okay. Okay, so I'll update that. So once you update a client's file, anytime you come to the care card, everything you updated anywhere on the system reflects on the care card. Now we see that we have results for drug resistance here. So you already know what the client is resistant to. So this is all the functionality for HIV management for an adult. I don't know if we have any volunteer to go on case 2. The pattern is when I do one case, I want somebody else to do another. So the hands-on will help us understand, and then I'll be able to see which area of the training to improve on and see the understanding. So I don't know who, anybody volunteers to share screen and try to enter record for case 2.
Okay, Mildred, I'll try it.
Log into patient management and reporting system. So on the right side, expand the pages menu. Scroll down. You have the case scenario in the chat. Do you have it with you there?
In the chats?
Yeah. If you have it, it'll be easier for you.
Yes, I have it open. I can read it while she's entering it.
All right. So you can go back to, yes. So now you come to clinical management, go to waiting clients. So here, what we have here are clients that we have used. You want to use a new client afresh, right? So you go back to pages, scroll down, go to appointment/patient monitoring. Then you're going to view pending appointments.
Okay, so the pending appointment.
So use AN123.
AN123. Okay.
So can go back to patients. Yes, appointment/patient monitoring. Then you create visit/record vital signs. And enter the unique ID, AN123. And start. So you get the blood pressure. So Stephen, can you read?
Yeah.
Andrew is a 25-year-old male inmate diagnosed with HIV and PCP on 24th August 2019 with a baseline CD4 of 45 cells per millimeter cube, viral load of 300,000, weight of 130 pounds, is afebrile with normal blood pressure. He presents today with loose stool, abdominal cramp, sweat, fever, loss of appetite, and a 12-pound weight loss over the last 4 weeks, temporal wasting, abdominal tenderness, lymphadenopathy, and peripheral edema. Current medication is adherent to current medication. It is Combival, one tablet BID Nefnavir 1000 milligram TID, and trimethoprim sulfamethoxazole for secondary PCP. Labs CD4 of 100, viral load of 200,000. Stool exam showed 6 of Giardia, Lambia, and Entamoeba histolytica, several Entamoeba colicyst, Endolimas, nanacyst, and moderate Amoeba buccellicyst. Aquamarine staining showed moderate cryptosporidium. BDR reactive titer of 128 TPHA reactive. Is EPIS positive as well. Differential diagnosis of disseminated Mycobacterium having complex PCP cytomegalovirus, E. coli, syphilis EPIS, Yersinia, and rotavirus infections. Treatment and plan. Metronidazole 250 milligram BID 1 in 52. Hydration and nutrition, review ARV regimen, take note of the drug-drug interaction between the oral solution from form of protease inhibitor and metronidazole, report to local health authority, and educate inmates on mode of transmission and good hand washing skills. So that is what we have for Andrew. So there is no record of his temperature, but we only have that is febrile today. So we can, he has fever today, so we can assume a temperature of fever. So we can give him 100.4 Fahrenheit.
You have to record Fahrenheit below and Celsius above. Okay.
His
Blood pressure.
His blood pressure today is also not given.
So assume anything.
Yes, we can assume a blood pressure for him.
The pulse.
Yeah, pulse of 88. But because it's February, though, the pulse will go up. The pulse can be 110. Because it's February, the pulse will go up 110. Yeah, respiratory rate of let's say 22 because of the fever as well.
And the PCP?
Yeah.
Yeah. All right. We don't have. Okay, his original weight was 130, but he has lost 12 pounds of his weight. So we can make its weight now 130 minus 12, that would be
118.
118, yeah.
No, 118 pounds. Record pounds above.
118 pounds.
Yeah. So you go to height in centimeter. Let's assume 165 cm.
Yeah.
And go to BMI and it's going to generate. Click on height in meter. Go back to click on height in meter.
Yeah.
No, click on the height in meter in the click inside the box there. Yeah, then go back to BMI and click on BMI. And it's calculated. Yeah.
Okay.
So now you go down. Since it's not pediatric, it's send. Okay. Yeah, okay. So now you go back to pages there. Then scroll to care card, to clinical management. and HIV care card. You put in the unique ID, AN123, and get forms. Okay. So you have all of this information. So you scroll down to start. Okay, so now if you want to repeat vital signs again, you can do that. If not, you move to adult or adolescent symptom review. Yep. So presenting complaint.
So he has loose stools, abdominal cramp, sweat, fever, sweat, fever, loss of appetite, weight loss, and swelling of legs.
Okay.
Weight loss and swelling of legs. Right.
Okay.
So if you have additional comments, you put it there. If not, you go to. So for additional comment section, you can put things like maybe an event that happened that triggered those symptoms. If you have those kind of information, you go to additional comments.
Yes, we can put. He also for the additional comment that's the abdominal tenderness can go there. Lymphadenopathy.
So that will be detailed finding, right?
Okay, yeah, that's true.
So go on that detail.
That's true. Yeah. Abdominal tenderness. Lymphadenopathy. And peripheral edema. So it doesn't have oral thrush. No, it doesn't have oral thrush. It doesn't have a
Rush,
no rush, yeah. So that's wasting and on significant weight loss, fever.
Yes.
Fever. Yeah. So condoms. He's in prison. Do they give them condoms there? You fill in it if he uses condom. If not, not using any family planning method. Then if you're filling this form for someone who is out of care, if not applicable. Assessment.
Symptomatic and opportunistic infection is right. So we want to high prophylaxis, lab evaluation, or prophylaxis.
Prophylaxis, treatment.
Symptomatic treatment and pain control.
Treatment. Where is it? Okay.
Yep.
And
ARV therapy. You're going to continue current treatment. Go. So now we see that his initial CD4 was 45, right? And his current CD4 is 100. You want to see, do you want to do drug resistance test since the CD4 is not going up as much since 2019? His CD4 and his viral load is still very high.
It's still very high. It's going down, but it's still very high. Yes. So
you want to do ongoing monitoring and postpone ARV for clinical reasons.
And why is that? Oh, ongoing monitoring.
Yeah. And the next one is choose the regimen if it's applicable. If not, you can leave that.
Okay, we're going to leave it out still.
Yeah.
So
And
I press cancel.
So you can just cancel, yeah. Then you can go to the box below and put in any medication you want for the symptomatic treatment or pain control.
Okay.
So it says metronidazole on the scenario?
Yeah, it's on metronidazole 250 milligram BD.
BID? Yeah.
Yes.
For 1 month?
1 week.
Yes.
It's supposed to be 1 week, right?
Yes, yes, for 1 week, yeah.
Yeah, for 1 week.
152, yeah, 1 week.
Twice a day?
Yeah. Then save.
What again he's on? What are the medication he was placed on?
So that's metronidazole, and then was cancelled on good hand hygiene, hydration, and nutrition.
Okay. For hygiene.
Also educate inmates on modes of transmission.
What's the next step?
So you can decide any other treatment plan you think you will do in reality and right there. Yeah.
He has, I see his VDRL is positive, it's reactive.
Yes, his VDRL is reactive. He also has herpes. So you want to do the prescription. So the scenario says continue treatment based on what you think you will do.
Okay.
Yeah.
So we have to add it here.
Yes.
Yes.
Okay. So we can add the Panadol.
Mm-hmm.
Maybe it's okay. We also have cookies. So we're going to add some aciclovir. Well, he also has disseminated mycobacterium. What we did, we hospitalized him, right? No?
No,
No.
you didn't hospitalize, but you can decide to hospitalize there.
Yes. Yes, because he has disseminated mycobacterium. He has
Yes.
he may need to get some of the medication IV instead of PO since he has so much
Severe
GI symptoms.
Yeah.
So this he may get IV instead. So that will be given at the hospital.
So you want to screen for TB also?
Yes. Where is it?
No, you do that up once you go. There, screen for
TB. Yeah. Screen for TB, yeah. And OI therapy, you get that at the hospital, no?
Yeah.
Okay. Thing is, when he gets, in our case, when he gets to the hospital, we're the ones going to be seeing him at the hospital. So
you just update it.
Yeah. Okay.
So it's stable. Okay.
What do it says about the drug resistance testing?
Okay. Yeah, okay, we'll go there. Okay, scroll down. So now you did this, you want to do TB symptom check now after the symptom review. So, date. So coughing for more than 3 weeks?
No.
Persistent fever, yes. Coughing of blood, no. Excessive night sweat?
I didn't see that.
He said it sweats up.
Night sweat, Stephen, I can't remember hearing that.
No.
No. Yes. Night,
Okay, yeah.
He sweats.
Okay.
Yeah.
Mildred.
Yeah.
On the previous page, shouldn't doctor have for the tick for TB screen on the previous page? The one she was doing previously?
No,
yes,
yeah, it was just part of the plan, right? Part of the plan that this is what she's going to do. But the symptomatic check is something that gives you, that makes you know if you want to actually now send for a TB screening or you just want to put them on CPT.
Oh, okay. Thanks.
Yeah.
No. Chest pain, no. Fatigue, no.
Well, he should have fatigue if he has so much wastage.
Yeah.
Yes, he should, but the case did not tell that, but we can add that.
It's
Yeah,
true.
fatigue.
Okay. Interview, we discovered that.
Loss of appetite, yes.
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 Unexplained weight loss, yes.
Yes.
Then
No.
No. Has no. No. Or unknown. No.
But there's no option for unknown.
No, because there's no unknown to it because it's either yes or no question because either he knows someone has TB and he was with the person or he doesn't know and it's no.
Okay, all right.
So is he a suspect for TB? Yes.
Yes.
Below? Suspect, non suspect? Referred for AFB? You want to refer for AFB? Yes. If not, no. For chest X-ray, if you want, yes. If not,
yes.
no. For TB treatment, you want to hold off that for no, for now?
We can give him TB treatment.
Okay, so yes.
So he's positive for TB. So wait, when we say yes, if we don't have the results as yet, we put no.
Yeah, we put no. Yeah, if you're not going to start TB treatment, no.
No. Okay.
But if you are giving preventive therapy, then you select the type of therapy in the last one.
So if I was going to put him on this, we'll put him on the Septrin and isoniazid.
Okay, so same.
So I would say he's not referred for treatment because we don't have the results yet.
Yes.
Yes, but in that case, you wouldn't start anything. You'd wait for the results. You wouldn't start isoniazid either, because that will be setting up yourself for resistance. So you have to wait for trial results.
That's true. So we'd have.
Go back up to choose here.
Yeah.
So you don't have any option.
Yeah.
So
Clearly, you want me to come up to Dominica for you, man.
Hi. Okay.
Save. So you just save now? Okay. Yeah. So scroll down. We want to update the CD4 and viral load that was stated on the scenario. Go down. So you look at them. Okay, we have update CD4 viral load. So
yeah. So it's
put in the date.
Oh gosh. What is there? I think he said, was it 100 still?
Yeah, 100.
Is CD4 today is 100? Yeah.
Viral load is 200,000.
Viral load is 200,000.
Okay.
Okay.
Then save.
Yeah. Okay.
So scroll back down. You can go to clinical staging.
Wait stage?
Definitely not stage 1, not stage 2.
Yeah, wait stage.
Stage 4. This is.
Yeah.
Wait stage 4.
Right?
Yeah.
But again, he had disseminated.
So he's in stage 4 actually, based on all the symptoms.
Yeah.
The symptoms are all in stage 4.
Okay.
Cytomegalovirus. You have.
Where is it?
Yeah, that's there after.
Yeah, below Kaposi sarcoma.
Oh, okay. Yes.
And then save.
And again, he had.
Yes.
Okay.
And PCP as well.
PCP.
Yes.
Go up. Scroll.
Stop.
Yes.
The second one. Right. This one.
Yeah. Then scroll down. It's like there's one more. Herpes he has is not herpes simplex, right?
He has. Yes,
no,
he has.
Not herpes.
He has herpes, no? Yes.
He has herpes.
Yes, he has herpes.
Yeah.
Okay. I think, did they say he had this schistosporiasis?
Yes, sister.
Okay. Yes.
Okay.
I'm naturally.
Mildred,
Yes.
this person can't survive. They have too many things.
So she's going to be hospitalized, right?
Yes,
Sure.
we said hospitalization.
Just the share medications will kill this person.
So, what do I do save now?
Save, yes.
To save.
Oh,
Put the
it's
date.
required. Okay, put that in.
Yeah.
Okay.
Save, okay. Oh, we just killed somebody.
We did.
Scroll down.
Okay.
So,
Yes.
so mental health assessment or evaluation. So he's in prison. So yes. Was it the client incarcerated in the past 90 days?
Yes.
He's on HIV medications, yes,
Yes.
prescribed, and he's adherent according to it. Yes.
Yes, it's adherent.
So he's not on any psychotropic medications.
No.
Just leave that blank here. Unprotected sex in the past 90 days. He says,
We are not told, but it's likely being in the prison.
yeah. Illicit drug use. Let's say no, he's in prison and is controlled.
Prisoners use drugs.
Yeah.
Any sex without, okay.
Yes,
Yeah.
Yes. Trauma stress.
So there's nothing you have here for now. So you just scroll down and do the assessments. This guy will definitely be depressed. Let's put 4 for him.
4.
The highest domain score
I have a
is 4.
question though.
Yeah.
Don't we have to stop the ARVs when he has started the medication for PCP and then restart in the next 2 weeks?
No, he had PCP. I mean, PCP was always diagnosed as a secondary infection from the time he was diagnosed for HIV. So PCP is something he always had, and he was being treated for both HIV and PCP from 2019, right? But it now looks like there's a drug resistance, so he's not getting better, and it's adherent.
Okay, so it's resistance. Okay,
Yeah.
Cool. So then, wait a minute. So that means we were supposed to send him for adolescent counseling in the first page.
No, we didn't send him for adherence counseling because is that?
No, I don't think so.
No, because he's adherent, and maybe according to the scenario, it is proving that he's adherent to the drugs.
Oh, he's adherent.
He's adherent, but he has drug resistance. It looks like he's resistant to the drugs, but he's adherent. Joseph.
Okay, let me just.
So at the end of this form, you see this box where you put highest domain score. So once you finish with the domain, you record the highest score there. No, you've not done that. Before you leave that line, the first line, depression. So highest domain score 4. Yeah.
3. Step less than
0.
No, there's no energy. That would be 4. No? He has no energy.
Yeah. No, but the question is asking slept less, but slept less than usual, but have lots of energy. So it's zero.
Also,
Yeah.
okay.
So both of them are zeros. And the highest is 0. Felt nervous, anxious, frightened, worried, or on edge, felt panic about the situation. Let's say he's always in panic mode now, since he's feeling he's going to die.
Okay.
So 4, 4, 4.
Uncle, look, they have crackers.
Directly experience. Let's say you say yes, that yesterday somebody stabbed a prisoner, or a prisoner stabbed the warden or something. So it's a traumatic event for him.
Okay.
So with 4, attempted to avoid distressing memories. 4. Had serious thoughts of hurting himself. You say no. 0. Heard things other people couldn't hear, such as voices. Let's say now, because he's very sick, he's beginning to have problems up there. So say yes. Yeah, sometimes 2. And 2. The highest domain score 2. The number 15 is 3. You put 3B.
3B?
Yeah, up there. So 3 here. Then unpleasant thoughts.
4.
4. So let's say he says no, he's in prison. So everybody there, nobody's discriminating.
And he's not disclosing his status.
Yeah, so 0.
I look at this one. Not known who you were. Not felt close to other people or enjoyed your relationship with them. Okay, because if he depressed and all these things, I guess 4.
Yeah,
or 3.
4. That's a 3, 4. Yeah, anyone.
Drunk at least point. No, he cannot get alcohol in the prison. He shouldn't, I hope.
So use medicine, no. Try to reduce or stop drug or alcohol use, no. Engage in sexual activities, no. So everything here is 0.
Okay.
So felt guilt or shame either before or after engaging in sexual activity, no.
No, yes, because they say he's still having sex in prison. Okay.
So 0.
No one told y'all that the man is having sex in prison. That's stigma.
That's stigma.
What if he's a big, strong man who can fight off these people, and he's not into that sort of stuff?
No,
or
but
if he's not getting his conjugal visits.
No, but maybe he's a big, strong man that is into this stuff, and it's normal for him.
But you don't know. Though you don't know, so you have to put no. Until you ask, you don't know.
Yeah.
Okay, but I thought we were taking up the scenario as we're going along.
Oh my God.
This is how you get in prison, eh? This is how you would get in prison.
Same. Yeah.
Okay. Good. Roy had said to check him.
Okay. Scroll down. So scroll down.
Roy.
Yeah, so you're done with everything. You can go to treatment and see what is there.
Treatment.
Yeah, so you have this test, no medication prescribed here. So you want to leave it. You want to leave that blank just for you to check if there's anything you want to do here. But for now, you're not giving any TB prophylaxis. You're not giving any ARV. So you leave it blank.
Okay.
So you want to go to pages now?
Pages. So you save?
No,
Save
just
it?
leave it. No, leave it.
Oh.
You didn't enter value.
Okay.
So go to pages. Go to, now go to screenings category mortality update. Then other or update screenings. Enter the unique ID. I think the system will accept it, whether capital or small.
Oh, okay.
Get that. So now you want to go to TB screening. You want to put in the dates. The type of test, select. So you want to do the gene expert MTB RIF. Then the results, now you're awaiting results, right? So just select awaiting in results. And then the test result date. Put today's date, so the date you're ordering the test. And save. What other screening? Drug resistance testing at the end. The last one. So this. And yes, meets criteria for biologic failure. And a change of heart is under consideration, yes. So you choose the type of drug resistance test, HIV drug resistance test, integrates testing, GP41 resistance test. So HIV drug resistance. No, select HIV drug resistance there. Yep. And then put the name of the, are you going to select name or they're going to just do the drug resistance test for what the client is on?
Well, I don't know what they're going to do.
So we want to test, he's on, the scenario says, what medication is he on, Stephen?
Stephen.
Yeah, I'm here.
Concombivir, right? Well, let's see. What medication was he on?
He doesn't go on right.
Okay. Okay, you want to do a resistance test for...
You don't have to click any of those three because he's not on any of those.
Yeah, he's not on any of those, yeah.
No.
Can you hear me, please?
Yeah, we can hear you now.
All right. Conbivir, 1 tablet twice daily, and Nelfinavir, 400 milligram 3 times daily.
Is Conbivir is it a nucleoside reverse? Is it NRTI or what kind of drug is it?
It's a protease inhibitor.
Okay, so it's process inhibitor.
No,
No, it's not.
Right?
it's NRTI. Mildred was right.
Okay, it's NRTI.
Right?
Yes.
Oh, okay. Yeah, just.
But do they still use Conviver now, or there's something else we use?
Yes, it's the same thing as Idolam.
Okay, so you just put the name there, the name of the drug there.
Okay. All right.
Well, Mildred, they were still phasing it out, and
Exactly.
after they made us switch patients to a dolutegravir regimen, then they bought more of it.
Oh,
And a
okay.
lot. So there's still a lot to be used.
Oh, so let's say the type of mutation that this one has is
You can probably do the HLA-B57 because it's the same class of drugs.
yeah, the undertropism. Yep. So what kind of mutation does Conviver normally have, actually? Is it has the same mutations that is that?
It would be M104K.
Okay, mutation M104K. No, under mutations.
No, but I mean, at the end of the day, they will tell you what they find.
Yeah, they'll tell you what it is.
Yeah.
But want to assume that we have a result, right? So just fill it in and see how it goes.
But you can't put Conviver in this thing because Conviver is a brand name.
Yeah, it's a brand name.
Yeah, you would have to put AZT, 3TC, MVP.
Okay. And if you AZT, so if you put AZT 3TC,
you probably need more than one drop-down boxes in this file.
Yeah, maybe I will just put the name.
Yeah.
I will just allow it auto select the name of the drugs from the list of medications on the system.
Yeah.
So that you can.
Because you can't put them bunched together.
Okay.
Because MVP would be in another class.
No, you can add row. So you could just keep adding more drugs.
Yeah, okay.
So click
right,
on
so
add. Yeah, just to
you have
AZT.
to add a row. Yeah.
And let's say the mutation it has AZT normally has a K101E mutation, right?
But this is the result. We don't have the result yet.
We don't have the results. Just leave the results. And on
You're
that
making it up? You're gonna make it up?
Yeah, we're making it up actually. So AZT put a K103 mutation. K103N. Right. Then for 3TC has the same K103N. Or K103S. K103S is usually intermediate resistance. K103N is usually high level resistance. Then MVP is an NNRTI, right? Yeah, it should be NNRTI. So let's say it has a V90I resistance for MVP. So V90I resistance. And let's say they choose resistance, just say susceptible. What am I saying? Yeah, the type of resistance, just hold on, susceptible. So just ignore those ones, the susceptibility score and all that. And you can save. If you have more, you can keep doing all of it. Scroll down to save, or you add row if you have more. Yeah. Okay. Okay. So now, if you go back to the client care card, so let's assume that this drug resistance result, or this is a different clinic day. So go back to pages. Scroll down, then go to clinical management and go to HIV care card. Enter the unique ID. Now look at the flags and see that. Scroll down. So you see the drug resistance is updated there. So every time you see a client, you know what they're resistant to or not. So you can now change that the first line medication might not be the best anymore. And then you can go to treatment and give a new set of medication. Treatment. Now on the treatment, you also see that the TB testing was ordered and you're waiting for the results. You can choose drug now. So select choose drug under treatment. So scroll down. So you want to do ABC 3TC. The resistance was to 3TC.
Oh.
Yeah, so you want to select another one, TDF, FTC, or something else. So second line, the dose, is it 300? So duration and frequency, and yeah, duration and frequency. So we want to start for 30 days and see. And if you have a second medication you want to give the client, you put in or you cancel the second. So if you want to assume that TB came back and he has TB, you want to start with, is it 2HRZE, intensive phase?
Mildred, question.
Yeah.
It doesn't allow for you to type?
No, it doesn't allow you for you to type. Because but what happens is that this list is not configured by the system, is what you enter. So during the configuration phase, you have the option to enter the list of all drugs you are going to be using. So every day you can go back to the system configuration and update medications if you want to change medications or you want to add more to this list.
Okay, understood. Okay.
So it now depends on the country now. Whatever you put on your list is what you will have here.
Okay. Did we get back his TB results?
So let's assume we have gotten it now, right? And it was MTB was positive, RIF was let's say RIF was sensitive, was not resistant, right? But we'll start with 2HRZE, intensive phase. And select intensive. So how many doses? Is it 56 doses or?
Well, let me see, daily. So it works out about almost 60 doses, 2 weeks, 2 months.
2 months, yeah, 8 weeks, yeah, 2 months. And so it's daily for what? How many per day? Is it twice daily or once daily?
Once daily.
Okay, so you have the 56 doses. Duration is 8 weeks. And then you add row again. And then you're going to do the continuation phase of 4HR. Next drug. No, 4HR.
Okay.
Scroll down. Scroll down to the end. To the end. Yes, continuation phase. And I think that is for 18 weeks, right? So that will be 18 weeks. That will be 126 doses.
18 weeks is how many months?
18.
That's about.
Yeah, so that's 100. Yeah, so that's for 4 months. And that is 126 doses. For 18 weeks. And then when that client is on this medication, you want to do the you want to look at the HB-WBC liver during the next visit, right? So you might leave it in the notes there to screen for those things on next visit.
Mildred, of course, I got distracted.
Is that?
I got distracted. You were saying
I said under the notes there, right? The notes you can put in what you want to do based on to check for side effects.
Oh,
right?
Okay. All right.
So if you want to screen for during the next clinical management visit, or you want to at the end of the 8 weeks or after 4 weeks, you want to do a liver panel or something, or whatever you want to check.
Okay.
You just leave a note there so that the next visit, anybody can continue and know what you plan to do next time. So because this client has TB now and is confirmed, right? You record this treatment to have this HIV TB co-infection, but now you want to refer this client in an event where it's not the same doctor who sees the HIV that sees TB. You want to go to pages. You go to pages. No, pages on the right. Go to referrals. And then refer new TB case for treatment and management. So if you are giving a referral and somebody different is doing the TB, that's where you go to. You put the date. The month, the year, the unique ID. And then you choose here. To the category. So select that to give you as an adult. You select adult. And then you save. Refer. Okay. Then okay. So let's assume now you are a different doctor who deals with TB alone. You go back to pages. You go back to clinical management. Scroll down, clinical management. Uh-oh. Go back. Yeah. So no, go to, no, not there. Go down to clinical management. Scroll down to clinical management, then choose TB care card. Enter the unique ID now and get care card. Now scroll down. This is dedicated TB management portal. So scroll down. So if you want to have advanced TB management, this is what you will do. You refer, you can see the HIV TB co-infection, and then you can also come back. So on this, let me explain this for you. Scroll back up. The first line of tab, you have personal information, risk factor, comorbid information, HIV screenings, TB, syphilis, other screenings. Those are just transfer of all the files that the client has on the system, apart from the HIV files, so that you can just review if you want to. But where you start from now is registration information.
Okay. Registration information.
On the second line, yep. Yes. And then now scroll to the, yeah. So you want to find out, has the client ever been vaccinated with BCG? For the date, 17th. So let's say he said yes, he had BCG at birth. Previously treated for TB, no. The second one is no, the previously treated for TB. Then, so does it take greater than 15 milligrams of prednisone for greater than 1 month or currently on prescription arthritis medication? Say no. And is he an employee of a high-risk setting? He's a prisoner, right?
Yes.
So he's a resident of a correctional facility, yes. So you save. So now that he has been registered, you can also do contact tracing if you want to, because most of his people